852, 95.3 WBCK. If you're a regular listener to the program, particularly at this segment, you might remember we talked on Ask the Expert with Dr. Troy Pascoe, Medical Director of the Bronson Wound Center and Hyperbaric Medicine in Battle Creek a while back. Touched on the subject of hyperbaric oxygen therapy and the idea of soft tissue radionecrosis. Today we're going to spend a little more time trying to understand that. Good morning, Doctor.
Good morning.
So what is soft tissue radionecrosis?
Well, first I might mention that radiation therapy has progressed greatly in the last few decades, and certainly in the best of hands, there's always a low risk of late effects, particularly poor healing, such as areas that have been previously irradiated, such as ulcers, particularly painful cystitis, which is a bladder condition, and proctitis. In my opinion, hyperbaric therapy is something that is uniquely effective against these late effects of radiation therapy.
Mm-hmm. And how does hyperbaric oxygen therapy help?
Hyperbaric oxygen therapy helps by increasing the capillary density. Going back to the original radiation therapy, what occurs is you basically get a reduction of the capillary density, causing very poor healing in those tissues. Radiation therapy restores that capillary density and improves healing in those areas that had been previously irradiated.
Mm-hmm. So when we talk about hyperbaric therapy, I think I think we talked about this before. You think of the whole bubble thing and all of that. Mm-hmm. Is that realistic?
Absolutely. And as I mentioned, in my experience of over 13 years, I have found this particular disorder. One, I find that patients frequently aren't aware of this treatment that's available. And I say that these patients frequently suffer in silence. And certainly one of the reasons why I wanted to get this message out today is that we still occasionally find providers, physicians that are not aware of this treatment for the late effects of this. And to remember that these things can occur anywhere between a year to up to 20 years or at any point of the lifetime of the patient. But again, I have found this to be a particularly effective treatment for these conditions, and probably one of the most rewarding things as a provider to treat.
Okay, so if you have questions about soft tissue radionecrosis and how hyperbaric oxygen therapy can help, the Bronson Wound Center and Hyperbaric Medicine office is right here in Battle Creek, and so all you have to do is give them a call and make an appointment, and they'll talk to you about that, just like we did now. All right, Doctor, thank you for reminding us about it.
Thank you.
Dr. Troy Pascoe with the Bronson Wound Center and Hyperbaric Medicine in Battle Creek here on Ask the Expert, 850.